Yes friends, welcome back. So in earlier video we have discussed heart and circulation. Now today we will discuss a very important disease or complication of cardiovascular system, that is called as angina pectoris. Angina pectoris. Now angina means, the word means strangulation or feeling compressed, and the muscle which is here in our chest region is pectoralis muscle. So the word is angina pectoris. So what is angina pectoris? When you feel a discomfort, a kind of choking, a kind of like heaviness in your chest. You see so many people, when they are on railway station, they climb the staircase or they are going, they stop. Particularly older people, even young also. Young will not stop, but older man will stop and take rest, and then he is better, again he starts climbing. Why that? Because as he is walking, his demand of the oxygen in heart is increasing, okay, and supply is not increasing. So there is an imbalance in myocardial supply and demand. So this supply and demand, there is an imbalance. Demand is more, supply is less, so he stops because he feels discomfort in his chest. So friends, for everybody, if you are a marketing person, director, any activity if you do, you feel discomfort in breathing, discomfort, you feel heaviness in chest, please stop. Stop the meeting. Go to a doctor and check. There may be inside complications. So don't ignore these warning signals. Remember, God always gives you warning signal whenever there is a problem with your body. Either there is a pain, there is a discomfort, or you feel something abnormal. But generally we avoid. And the price will be much higher. So in angina pectoris, the demand and supply, there is a imbalance. We have discussed, God has given your heart enough capacity to meet 5 times the demand. In place of 5 liter, it can throw 25 liters, no problem. And your coronary dilates and it will keep you healthy. But we have some good habits. So because of good habits, now we have complications of coronary artery diseases. And what are the risk factors? One is the obesity. I know I am also little obese. I have central obesity because my job was only meeting and eating. And I used to say, what is a meeting without a good eating? So every meeting should be a good eating. So obesity. If your body mass index is abnormal, you have particularly central obesity is very dangerous for you. Because obesity puts direct, pressure on your heart. Around 1 kilogram body weight extra, and the length of arteries and blood vessel will be around 2 kilometer. So the heart has to pump blood more 2 kilometer, 1 kilo extra weight. So obesity is one very important complication. And then this junk food and high cholesterol, particularly containing LDL. If you are low density lipoprotein are more in blood, or VLDL, very low density lipoprotein, VLDL. These are the HDL is good, high density, it does penetrate in the arteries and does not cause much atherosclerotic changes, it is protective. But LDL, if your cholesterol level is high, this is risk factor. So eating lot of fatty food, fried, we Indians love to eat bhujia or any fried samosa, kachori, we eat fried food. Now this is very risky, friends, food. So cholesterol when high, and the one is very good is smoking. Smoking, now on every cigarette pack there is a picture also. On tobacco there is a picture of lungs, these, there. On TV also there are advertisements. Well, people don't listen. Smokers are always smokers unless until something serious happens to them, or if they listen my video. If you are a smoker, friends, believe me, stop it. There is a age up to 40, 45. If you have smoked, it's okay. Me also, just to tell you, one time, some smoking I used to, but a time came long back, stopped. because lungs will again be clean. So stop smoking. Believe me, it is a dangerous cardiovascular risk factor. And also excessive drinking. Well, alcohol as such is not bad in moderate. In moderate quantity, if you take a red wine or any alcohol, one peg, a small quantity, it's okay. But excessive drinking, there is a saying, man takes one peg, one peg takes another peg takes another peg, and that peg takes the man. This is what happens, friends. So many people have died worldwide because of excessive drinking. Drinking as such is bad because it puts financial problem. You and your anything during drinking stage you can do. Any mischievous, any crime, anything you don't know because you are drunkard. So best is don't drink, stop it. If you are a drinker, stop it or be a social drinker. Once in a blue moon, there is some occasion, okay, celebrate it. But excessive drinking is a big cardiovascular factors. And then excessive stress. Excessive stress is something which is always, problematic for us. Stress is good. Little stress is good for our life, for our survival. But excessive stress, when you are not able to take rest or you are not able to sleep because of too much ambitions, too much, achieving, you want to achieve too many things in too short a period. This is what is dangerous. You want to be a millionaire by the age of 25. You are not happy with the small car. Even Skoda is not enough. You want to have, Jaguar or higher car at this age. Such goal when you set, friends, they put pressure on your cardiovascular system. So many young executives, young managers, marketing managers, directors, they left us only because of, we call them as a personality type A. So personality type A people, they want to achieve too many things in a too short a period. Everything takes time. Ambition are good. I am not denying. But too ambitious and wants to achieve, then it is at the cost. Remember it. If you are ready to pay the cost, you are ready to die at the age of 45 and wants to have Ferrari by the age of 40, and you say I will die 45, then it is okay for you. There is nothing comments from my side. But ideal advice would be that have a reasonable stress, and if something, don't plan a mission, a goal which is too difficult, and in that you want to suffer, because you have to balance it. Balance your life, achieve success, and have good life also with your family, with your friends, and they are great reliever of stress. So stress and these two, nowadays, diabetes and hypertension. Lifestyle diseases are good friends for us to go to heaven or wherever we are. So I don't need to talk how diabetes disturbs our body. Diabetic complication, there is a long list, and starting from your coronary artery. When you are diabetic, the first organ which gets affected is lumen of your coronary artery. So supply is reduced. Coronary artery is one. Your kidney damage, the nephropathy, the nephron and kidney are damaged. So your renal problems comes due to diabetic. Heart, your brain, ischemic attack come because there is a atherosclerotic changes or that, and also in your eye, optic, retinopathy, the diabetic retinopathy, there is a blood vessels in that, there is a damage, and then if they burst, your vision also goes. So there are a lot of diabetic complications. Do yoga, have balanced diet, and keep yourself. One thing which has helped me is my walking. When I was medical rep, even as a manager, even now, when I go in hospital, I go walking on the 5th floor, 4th floor cardiology and come down. So that walking kept me protected, and like that. So diabetic and hypertension, hypertension, what is something very bad in this disease is It is many times it is asymptomatic. There are no symptoms that you are hypertensive. And after your death, it is diagnosed that why did he die? He died of hypertension. During autopsy, it is known, oh, his heart was, it was a hypertrophy of left ventricle and it failed, or there was damage, coronary was blocked, and nowadays they are putting the stent. What is the stent? Nothing but putting, a tube, metallic tube in the coronary. So why did he die? Because his coronary was chopped. Okay? So, try to, control your hypertension, your diabetic, do yoga. Today, the world is becoming more holistic and more balanced. You have to do it. So, remember in angina pectoris, these are the complications. Angina, there are different types. One is very nice of angina of effort. Whenever you do any activity, there is angina. So if I walk second floor, I will have discomfort. And remember, angina is imbalanced temporary for 2-3 minutes. Once you stop, it is gone. There is no damage to the heart. There is no necrosis. There is no damage to the muscle wall. So angina of effort. It is stable. If you know up to this, it happens. Sometimes it is unstable. You don't know when suddenly it can come. Okay? So even during sleep, you suddenly feel choking sensation and you wake up. And when you wake up, it may be treated also. It may discomfort will go. And there is also entire rest. You are resting as I told you. And suddenly there is, a discomfort in your chest region and you wake up. Anxiety, rest. Angina, there is one nice decubitus angina. What is decubitus? When you are in a lying state, the posture, you are sleeping and suddenly you wake up. Why? Because in heart and circulation, your flow from body to the auricles is more. So more blood comes and your left ventricle is not able to pump the blood in that. So because of more flow of blood into the heart, you feel choking, decubitus, angina. And when you sit, because of blood has gone down due to gravitational force, you get relieved. So you find sometimes some people in night, they wake up and they feel discomfort. That is angina decubitus. And one is very important. All are important, but it is dangerous actually. Angina due to spasm. Contraction. What is the spasm? Contraction. Anywhere, spasm is a suffix. Broncho, spasm. So contraction in lungs, broncho, lungs. Okay. So it is coronary due to spasm in coronary artery. Remember, coronary is your lifeline. I told you, remember, left ventricle is the heart of the heart, and your life depends only on one artery, that is coronary artery. That is why, this the CHD or coronary heart diseases. Even the name is intensive coronary care unit. So what is ICCU? It is coronary. They take care of only coronary artery. Remember, so your life depends on coronary artery. So there is a spasm in coronary artery, and this is angina due to spasm, or I think Prinzmetal's variant angina. Prinzmetal was the scientist who explained it. So due to that, we call Prinzmetal's spasmodic angina. And so this is about angina. But remember, there is no pathological damage in angina. It is a warning signal. If you don't listen the symptom, now it will go to your myocardial infarction. When there is a cell damage, and then everything is done for you. Okay? Lot of drugs are there for this. Now what is the treatment of angina? Simple. Either reduce the demand or improve the supply. So there are coronary vasodilators. They will dilate coronary like nitrates, calcium channel blockers, and like this, and we do coronary dilatation, supply is improved, or reduce the demand. So you take rest, and also there are drugs which reduces heart rate, heart force. If there is excessive heart rate, there is a tachycardia. Tachy means more. This is a prefix, you remember. Tachy. And opposite of tachy is brady. So TACHY. Tachy. So if there is a tachycardia, because your heart rate is more, the doctor will give you suppression like verapamil, some special calcium channel blockers, to reduce heart rate and heart force. Okay, so they will reduce heart rate and heart force. This is the treatment. So friends, hope this video is little longer, and now next we will discuss same cardiology. We will continue. So thank you very much for watching. Enjoy.